Hi, Tracy from Kazadans Equestrian, and welcome to this week's video where we're talking about the fat-soluble vitamins that your horse needs in its diet. So if you haven't looked at the first one on vitamins, have a quick look at that now, because it explains why we separate the vitamins into both fat-soluble and water-soluble. This week we're looking at the fat-soluble vitamins, which are vitamin A, D, E and K. My next videos will look at the other vitamins, so if you're interested in working out how to balance your own horse's diet or understanding it more, then please don't forget to subscribe to the channel and click that notification bell so that then you get told when I release my next lot of videos about vitamins as well. Let's start with vitamin A. Vitamin A is really important for vision, both night and colour vision. It also has roles to play in immunity and genetic functions. Vitamin A is important not only for vision but for your horse's immunity, fertility and reproductive processes, red cell production. It's important for normal skin, eye and hoof surfaces as well. Vitamin A doesn't actually exist in plants, but it does exist in a form that the horse is then able to convert to vitamin A itself. So freshly growing grass has quite a lot of vitamin A in it, and sort of older or dormant grass has less. You'll find the lowest level of vitamin A exists in the old hay sitting in your shed, particularly if it's been there for a year or so. The normal maintenance suggested requirement for your horse is about 30 international units per kilogram of body weight. If you have a horse that's still growing or a horse in work, that requirement jumps up to about 45 international units per kilogram of body weight. Now, the suggested upper limit for vitamin A is actually 160,000 international units. But remember, vitamin A being a fat-soluble vitamin, and again, if you haven't looked at why it's important to differentiate these, go and have a look at the other video. But it means it's getting stored. And the vitamin A will actually build up in the liver and can become toxic to the horse. This is obviously really important in growing horses because it can actually cause developmental orthopedic diseases in horse. So you don't want to over supplement your growing horse with too much vitamin A. So obviously whether or not you need to supplement depends on the diet that your horse is getting. So a horse on green pasture that's just out is very unlikely to need supplemental vitamin A. If your horse is fed predominantly on hay as forage, you're unlikely to need it, except that it really does degrade over time. So if you're using old hay or low nutrient hay, sometimes again this is deliberate if you've got a metabolic horse, then you may need to look at a small amount of vitamin A supplementation. A good thing to look at is, does your hay have any green colour? If by the time you're giving it to your horse there's no real green colour left, it's likely that a lot of that vitamin A is just degraded now. So you may need to look, if they're not getting forage from fresh green grass as well, at supplementation. If you're not in that scenario, be really careful about adding vitamin A because you can of course get toxicity. If you're looking on the ingredients list of your horse feed and looking for vitamin A, it's most likely to look like retinol palmitate or retinol acetate. These are the things you would normally see on your ingredients list that tell you how much vitamin A is in that feed. If your horse is having a toxic dose of vitamin A, there's some things you can look for. Obviously, in a growing horse, it's really important that you get this right because you don't want any of those developmental orthopedic diseases. Also, in a developing foal, you can get just abnormal bone growth in different ways, so you don't want that either. But in other horses, you can also see itchy or peeling skin, swelling and joint pain. If your horse is showing some of these symptoms and you're not really sure whether that's an overdose or not, well then now you can go back and look in the ingredients and see if you're feeding too much vitamin A. And if you are, the only thing that you can do to prevent this now is to take the excess vitamin A away. Okay, moving on to vitamin D. Vitamin D is the sunshine vitamin. We all know that. So the horse can convert using a chemical reaction, the ultraviolet light, and convert it into vitamin D to be able to use for its own purposes. Vitamin D is very important in maintaining calcium balance and the calcium phosphorus ratio. So not enough vitamin D can cause rickets, bone fragility. But unless your horse is stabled or not seeing sunlight for 24 hours a day, it's actually quite unlikely that they will need to be supplemented with vitamin D. Certainly horses that have a lot of access to sunshine will be fine. You can, however, overdo vitamin D if your horse is getting enough and you're supplementing without knowing you're supplementing. In some of your vitamin mineral mixes or premix feeds, there's additional vitamin D. You can actually get a toxicity in vitamin D. And this excess is important because it's related to managing calcium. It accumulates in the liver and you can sometimes get calcium deposits in hearts, blood vessels, and other organs, including these little deposits in the kidney. If your horse is getting too much vitamin D, some of the symptoms you might see is just less tolerance to exercise. They may be losing weight, show some signs of stiffness when they're working, and often an increased heart rate. Vitamin D also exists in hay, but just like vitamin A, these things really degrade over time. So if your hay is about a year old again, you're likely to only have a minimal amount of vitamin D in this hay. So the reality is, if your horse gets very little sunlight and only fed old hay, this is probably the only time you'd really need to add a vitamin D supplement with your horse. Now on to vitamin E. Vitamin E is a really important vitamin for the horses, and although it's fat soluble, it's actually one of the fat soluble ones that you can't really overdose on. Vitamin E is important to the immune system, and it actually helps the body absorb vitamin A as well, which, if you remember, is also good for immunity. So vitamin E is a bit of a powerful vitamin. But its most important function is it partnering with selenium, and together they act as amazing antioxidants for the body's tissues. So it stops damage from free radicals to the body's tissues. If you remember from some of my exercise videos, whenever you are training a horse, you will be doing a little bit of muscle damage. This is needed to increase fitness and increase tolerance of fitness. They're just like micro damage. If you're doing heavy work with your horse, additional vitamin E can really help them repair and recover from that in a great way. So sometimes if your horse isn't recovering as well from a heavy exercise bout as it normally would, this might be a bit of a go-to supplement to see if you can get that repair happening quicker. If your horse is fed exclusively on premix and hay, it wouldn't harm to add some extra vitamin E into their diet. It does need to come from their diet because horses do not manufacture vitamin E on their own. It's available quite freely in green grass, but again, it degrades quite a lot over time. And in fact, it can degrade 50 to 80% just in the process of baling. So you're really quite diminishing the amount of vitamin E if you're only feeding hay and not fresh green forage. Of course, with anything that's good, too much of a good thing can be bad, so you can over-supplement your horse with vitamin E. It can interfere with the absorption of other vitamins, so there's no need to just throw tons of vitamin E at your horse. Just be sensible with it. So the National Research Council set an upper limit of 1,000 international units per kilogram of dry matter food. In saying that, there's been plenty of documented evidence to say horses in other situations really could do with and will tolerate a lot more than that. So if you have a horse that's either sick or working quite hard, going over this supplementation isn't going to cause them any problem. You could probably double or triple it. It's a fat-soluble vitamin, so the vitamin should appear in an oil. If you're getting your vitamin E supplement in a powder form, it's a really good idea to put it with some oil and mix it and put it in the feed. This way it's the best absorbed for your horse. The last of the fat-soluble vitamins that I'm going to talk about is vitamin K. Vitamin K is present in plants, but it's also synthesized by the horse itself in the bacteria in the gut. So although they definitely need vitamin K, given they can produce it themselves, it's normally unlikely they need to be supplemented with this. The most important function of vitamin K is blood clotting, but it can also help to inhibit the calcification on some of the blood vessel walls, so it's still an important vitamin. Not a lot of research has been done on vitamin K in horses either, so it's a little bit hard to give anything definitive. But one of those reasons is because they do manufacture it in their own gut, and we haven't really seen any toxicity or deficiencies appear commonly. If you do want to supplement vitamin K, phylloquinone is the best form of supplementation. The other thing that you will see on a ingredients list that is a vitamin K supplement but not as effective at all is menadione. And this is the one you'll commonly see in horse feeds. So in general, the supplementation in feeds isn't great, but the amount they get from their forage, and also the amount they produce in their gut is quite likely to be plenty to meet their requirements, unless they're really hard-working, high-level performance horses, and especially high-level performance horses that have exercise-induced pulmonary hemorrhage. But at this point, again, you really need to be working that in conjunction with your vet. So there we are, that's the fat-soluble vitamins. Hope this has been helpful. Like I said, please subscribe to the channel, click like, and look for the next one where we'll talk about, I think I'll do the vitamin Bs next, because they're really important, and there's a lot of talk around vitamin B supplementation and what it can and can't do. So I'll probably do that one next, but make sure you click that notification bell as well, subscribe to the channel, and I'll see you next week.